Hello, welcome. Today's video is in collaboration with the N8 Child of the North and Centre for Young Lives, where we'll be discussing the SEND report. So with us is Evie Shore. Would you like to introduce yourself?
Hello, yeah. So my name's Evie. I'm a researcher who worked on the report series last year and particularly worked on the autism and SEND reports. Of why this report is important as well. So it's in collaboration with the Child of the North, and that's all looking at sort of the structural inequalities within sort of special educational needs. So we can see within the report that there's a lot of inequalities by region. So how areas in the north of England, and within that more specifically as well, there's different areas that are more disadvantaged from accessing the diagnosis and subsequent support. So it sometimes can feel like a bit of a postcode lottery as to what sort of support you can get, and sort of the reliance that's put on parents for navigating the services can sort of differ between localities. So reducing some of that variability is really important as well, to make sure that things are sort of fairer across the country. But there's also inequalities within sex, ethnicity, socioeconomic status, and I think that's something you can see sort of the interplay of all of those factors as well, to create sort of even greater disadvantage. So that's something that's really highlighted in the report, and sort of the importance of making sure that all children are sort of identified early so that support can be put in place. So there's evidence that some of the more holistic measures, such as the early years foundation stage profile, is better equipped to identify the needs of children who are less likely to be identified through sort of traditional systems. So ethnic minority children and girls are more likely to be sort of identified through the
scores, instead of being picked up as a teacher going, oh well, I think this child needs a referral onto here, like that. They're more likely to go under the radar then, but the schools can kind of pick up on that.
Yeah, so there's a big importance of how teachers are obviously trained to know what level of development is appropriate for a child's age, and sort of picking up on when a child might be slightly behind where they're expected to be for that age, sort of within lots of different domains, social, emotional health, but also physical movement and literacy and reading, sort of being able to see across the board and sort of recognise when a child might need more support in that way. That's something that's already been done and then can be utilised, and it seems that there's a greater use for that, for doing so, for identifying children who face that disadvantage.
So that's like teacher-based assessment, more so than looking at the child as a whole instead of just academic attainment. So more through like how they socialise with peers or hold a pencil, things like that.
Yeah. So like you say, looking at them as a whole, and not just focusing on the academic sort of things, and taking into account their social, emotional, mental health and things like that.
Yeah, and I'm sure I think the report highlights some beneficial ways to do that, if there's any that you'd like to go into.
Yeah, so I know lots of like working through schools. That's somewhere where children obviously, so it's quite a trusted space to implement evidence-based approaches to supporting children. So using the school as sort of a hub to implement things. And to identify children. So one of the projects that's highlighted in the report is the electronic development and support tool, which is again leaning into the teacher-based assessments. So it mirrors some of the evidence from the EYFSP, but also translates that into matching sort of the areas of need to recommendations of what can be done to best support that need. And they're all things that can be done in the classroom without any additional training or resources, so that they can sort of be implemented easily within the classroom.
And does it give like examples to teachers? So like, can they is it easily identifiable for them? Like,
yeah, so it says it in a lot of detail. So like you said about holding the pencil, like can they have like a tripod grip of a pencil and different things like that. So that a teacher, these are all things that they pick up on already and things that they're already reporting. So it's sort of using that knowledge and honing that, and then giving teachers back the sort of things that they need to know about how to best support those things that they've identified. So things that can be implemented both on an individual level, but also within sort of small groups.
Like, does it give? So, what are the recommendations around this topic?
So one of the recommendations is about how we can better identify the needs of children with special educational needs and disabilities. So using more holistic measures. So there's evidence that school readiness from measures such as the early years foundation stage profile, that's taken to assess sort of the fundamental skills that a child has to make them school ready to go into year one and like reception year in school. So the assessments that's taken there around those fundamental skills has actually been shown to be able to predict how likely a child is to go on to be recognised as having special educational needs or disabilities. So those sort of holistic measures that get a good overview of where a child is at age 4 or 5 is a good indicator of how likely that child is to have special educational needs and disabilities. So that's like one example of where a measure early on in life can be used to sort of highlight children that might benefit from more support. And another recommendation is to improve the access to training for individuals, so SENCOs, teachers, and lots of professionals that work with children with special educational needs. So improving the continued professional development sort of courses for them to make sure that those training programs are co-produced by young people, families, professionals that work in the area to make sure that the training is addressing the right sort of areas and is sort of targeting the points that feel relevant to children.
It needs to be reflective to make a difference.
Yeah, and also like even delivered by people with lived experience as well is important. But that training to make sure that staff have the right awareness of how to go about putting in support for these young people is one of the recommendations that the report puts forward, and it gives some good examples of how that can be implemented practically as well.
Brilliant.
One of the third and final recommendation is to use more joint up data-driven approaches to supporting young people. So using linked data sets, so using NHS numbers to bring together data from education, healthcare, lots of different public services, so that you get that overview of a child's needs rather than looking at a child in sort of organisational silos of health, rather getting that overview and then sort of developing the most appropriate support based on them as a whole rather than any individual need.
Yeah, I think like realising that they're all connected and health impacts education, education impacts health and vice versa is really important.
Yeah.
And it's already available data, it's nothing new, it's just pulling it all together.
Yeah, definitely. And I think this report is what it calls for, that sort of drawing together, utilising the things that we've already got, but just working in a more of a collaborative way and drawing it together to utilise the things that are already there to give a more collaborative way of working to support the children.
Yeah, and the same with the early years foundation stage profiles. So every teacher completes that for children across the UK or England. Is that already like done in schools?
Yeah, so that's mandatory for all schools in England. So that data is already being collected. So it's just administrative data.
Yeah.
So that's already in place. So like utilising the things that are already there. Is important.
Yeah, brilliant. So what are the key takeaways from the report?
I think some of the key takeaways are about viewing children's needs as a whole and supporting them using evidence-based and innovative approaches that are detailed in the latter end of the report. So really using things that we've already got in place, so administrative data, and linking that together with data from across different systems to better support children and highlight where that support is needed. And also about giving professionals the training that they need to be able to implement things and be able to have that awareness that they need. I think are some of the key takeaways.
Yeah, sounds like a brilliant report. Thank you so much for joining us today. And if you want to find out about the report, you can read more about it in the link below.